So my talk was about immunotherapy toxicity, and so what are the side effects related to immunotherapy? And when we think about patients and families, I think historically they consider cancer treatment to be chemotherapy. And sometimes in chemotherapy, you just had to kind of suck it up or get through it or deal with it. And I worry because immunotherapy, actually, when they have side effects, the doctors and the teams want to know. So even if it's something like fatigue or falls or, diarrhea, we actually want to know. And it's important because these conditions of an overactivated immune system, if we are able to get to them earlier, they have better results and they can resolve more quickly without needing hospitalization or kind of additional therapies. So I would just say we're in a new era. We want to hear from you, and your team wants to hear from you as well. So that would be kind of the key thing, is to think about your own symptoms and then to report them to the team. Yeah, so I talked again, more of the serious side effects in the talk. I do think we have to know that they are rare, but the more and more patients that we are treating, we're starting to see more of these kind of serious conditions. And if they could do anything at their own individual institution, I think it's to develop a little bit of an expertise or a community around these efforts. I talked a little bit in the talk how we have admitted, honestly, over 300 cases of immunotherapy toxicity, and the most common cause was colitis at about 40%, followed by pneumonitis, hepatitis, and endocrinopathies at about 15%, and then neuro conditions and cardiac. So if you thought about kind of developing a team of experts, having GI, endocrine, pulmonary, cardiac, and neuro would be critical. And having patients that are seen by at least some kind of unified team that had expertise and develop these in recognizing these atypical presentations and management, I think it's critical. And I know it can't be done everywhere, but the more that we can do it, or have your own community site dock into a team that is doing that, I think the better in terms of managing this in a world where we don't know exactly all of the kind of next steps when it comes to severe toxicity. Yeah, I think we at Mass General have it kind of the best in the country because it is a standalone general hospital that our cancer center is connected to. And we have had experts in autoimmunity and all of these different subtypes and diseases at Mass General for the duration. And so for me in 2017, what we did is we put together a team. We actually have 19 different divisions and areas represented, and we're 44 people that we come together from all across the hospital to really think about these conditions. Since that time, we've actually seen all of the inpatients together, and we have kind of educational conferences on a regular basis every other week. So it's just the fact that Mass General has this wealth as a general hospital to have experts, not just in onc, but really it's around the board in terms of the cardiology, the GI, the renal, and so on. So it's been quite a fun initiative, and we're involved in the clinical care of patients because that's always the North Star at Mass General, is the patient, but it's also the clinical research aspect. So to really describe these cases and phenotype them well, and then translate that to the lab. So Dr. Villani is our translational lead to really start to understand what is underlying these mechanisms. And once we figure that out, we'll translate that back with therapeutics to the hospital. So I think it's a unique environment, always with the patient as the North Star, and collaborative in why we're going to kind of make headway in these conditions.